Well, there are all kinds of weight loss programs available. Some are just fads. Either they don't work or the weight just comes right back.
Yes, unlike fad programs, there's an FDA-approved system that delivers long-term results without surgery. It's called Orbera.
Yeah, Dr. Tom White specializes in this procedure. Good to see you, Doctor. Thanks
Welcome
for stopping
back.
By.
Thank you. Good to be back
again.
Thank you.
So tell us about this. How does Orbera work?
Very simple procedure. It's basically an inflatable balloon that we put down endoscopically over through the lighted tube. So it's like an upper endoscopy, come in as a quick outpatient procedure. We place this, takes about 5 minutes to do the actual procedure. Causes this to occupy the space in the stomach, and this is the little animated diagram here. So we're going down in the stomach with the balloon that's rolled up like a little cigar plastic tube. We're going to put the saline or fluid into the balloon, filled up to about 600 cc's, which is about a half a liter. Once that's filled up, we detach the tube and it sits in the stomach. So very simple, very safe, very effective procedure that doesn't involve any type of cutting or any type of surgery. And that's the real appeal to this procedure, is that it's a very safe, non-anatomy altering procedure that we'll go back in 6 months later, take out the balloon, and typically people lose about 30 to 40% of their excess weight. So if you're 100 pounds over your ideal weight, you'll lose about 30 to 40 pounds or more, depending on how well you stick to the plan.
This is fascinating. So we're seeing here, you take the fluid back out of the balloon and then you
Correct.
remove the balloon from the stomach. So if some people have thought about surgery before, I mean, this is really, when we say it's not as invasive, it's not invasive at all.
Correct. There are some risks with it, but like any procedure, any medical procedure that you do, but much, much less risky than any of the surgical procedures. Although the surgical procedures are also very safe, which a lot of times people will think they're not safe, but we've had very, very good safety records with our surgical procedures as well.
And we said before the break, you've done more than anybody else in the region, so
Correct.
you're certainly an authority on that.
Yeah, we're taking a look at some of the pictures. This is the actual balloon, and you're holding the balloon device in your hand as well. So how's this thing built to describe this thing?
It seems so simple but high tech at the same
Basically just
time.
plastic, little kind of a rubber plastic balloon, side elastic ring. It's very similar to the same material they use with breast implants, but not with the silicone on the inside like some of the breast implants got the bad publicity years ago. Very simple, has a little spot here where the tube connects. The tube goes in there, we just inflate the fluid. Once the balloon is filled up adequately, we detach the tube, and this sits in the stomach. So very safe, very effective procedure.
And you said for about 6 months is
Correct.
how long the balloon stays in.
Yep. And so any one of the surgical or non-surgical procedures that we do are just a tool. And so that's where it's really effective if we can get these folks into our program, start talking about the healthier lifestyle, start talking about some of the different behavior modification, making good food choices. And so if you don't adhere to those recommendations, a lot of times people can regain the weight, not just with this, but with any surgical procedure.
You're right, any surgical procedure, you got to follow the food program, the nutrition program afterwards. Who's this right for people, for individuals out there? Who would be good candidates for this?
So the FDA approved this for patients that are BMI of 30 to 40. So most women who are between 180 and 240 pounds. Most guys between 170 to 270 pounds. So if you look at it's the lower BMI patients and the lower weight patients that want to get 30, 40, 50, 60 pounds off. The other patients, I think it's going to be a great indication for somebody that's going to need to undergo a knee procedure or a spine operation that's a little bit overweight, but they don't want to consider a surgical procedure. If they come in 6 months before their knee or hip operation, can lose 30, 40, 50 pounds, can decrease the risk of complications from that knee implant or the hip replacement by probably tenfold.
Yeah,
That's
a really good
amazing.
point.
I hadn't thought about that. Because I'm just thinking about the people who have tried diet and exercise over the years. They didn't get the results they were looking for. They're not sure that they want to go with surgery. Maybe they're not even a candidate for that. This is a real solution for thousands of people.
And that's what we found when we just started doing the lap band 15 years ago. A lot of people that didn't want the gastric bypass would come in and consider doing the lap band because it's a much less invasive, much safer procedure than even the gastric bypass. And so this is going to extend that safety profile and say, certain people will say, okay, I'm okay having this done because at the end of 6 months, if I achieve the certain results that I want, perfect. If I don't, then you really haven't burnt any bridges at all.
This is your website, so if our viewers are watching now, I saw a form there. So what, you can connect with them that way if they just give you a few just simple pieces of information to see if they're a candidate?
Yep, so if they just put their contact info in, we'll get in touch with them and let them know, kind of what things we need to get done before we proceed with putting the balloon in. So most women, if they're over 180 pounds, or 180 pounds, and most guys, if they're over probably 210 pounds, are going to be good candidates for the balloon.
Yeah, can you expand a little bit? I know you talked about it's less invasive, it's safer. Expand. What are the risks? They're slight risks. What are they?
Basically the same risks with any upper endoscopy. So anytime you have an upper endoscopy with a lighted basically tube down through the esophagus, stomach, very, very small chance, but you could have some issues related to that. And that's really the main risk of the procedure.
Oh, sure.
Very, very rarely would this balloon break, and then the fluid, which is just saline, salt water, wouldn't hurt you, but this balloon may go down through the GI tract and cause obstruction. Typically, if it would happen, and it almost never happens, that would just pass on through.
Yeah. Once you have it in that 6-month period, do you have to be able to come back in for checkups, or what does that period look like from the point that you get the balloon until you take it out?
Yeah, we try and touch base with folks on a monthly basis and make sure that they're doing okay, not having much nausea and vomiting. Make sure, and typically you won't have any after that first 3 to 4 day period after the balloon's placed. Make sure we can assist them with making good food choices and dietary recommendations.
You know, you've mentioned that and touched on it. It's not just important, but that part of this is essential, isn't it? Because when you take the balloon out, you've got to have some healthy habits in place.
So the first patient we put the balloon in back in late November was a female who's about 220 pounds. To date, she's down about 40 pounds in just a little over 3 months. So she's done excellent. She's really stuck to the diet and exercise recommendations, as well as really started increasing her exercise. A lot of the problems some people have once they get even 50 pounds over ideal weight, it's very difficult to exercise, or they're self-conscious about exercising. So if you get down to a more manageable weight, then those folks can get back and do the healthier activities as well as healthier types of eating.
Are you intrigued by Orbera? Dr. White, this is his specialty, and he's performed more surgeries, as we're talking about like gastric bypass. He's done more of those than anybody else in the region, but here's an option that's non-surgical, and maybe call, see if it's right for you, or you can visit the website that we showed you and just fill out that simple form, and then they'll get in touch with you, and for that initial visit, could be life-changing. Dr. White, thanks for joining us.
Thanks for having me.
We always appreciate your
Good to see you
time.
again.
You too.
All right. Flowers are not